Dear students, our topic, iron deficiency anemia in children. Epidemiology. About 2 billion people in the world with anemia. With iron deficiency, about 3.6 billion people. Features of iron metabolism in children. Transplacental transport of iron, active, unilateral. No iron deficiency in the fetus. The need for iron at 1-2 years of age, 0.7 milligram per kg per day. In adults, for example, 0.002, 0.003. Iron in women's milk is contained in the protein lactoferrin, which ensures the absorption of 40-50 of iron in the intestines of the child. Lactoferrin also is a non-specific protective factor. Active metabolic processes occurring in the body of an infant lead to a decrease in iron depot by 4-5 months. From this age, the child's body becomes absolutely dependent on the exogenous intake of iron. In premature babies, the disappearance of the depot by the 2nd month. In the physiological course of pregnancy, a full-term baby is born with iron reserves of about 300 milligrams, received in utero from mothers mostly in the 3rd trimester of pregnancy. Premature babies or twins have reduced iron reserves directly proportional to birth weight. 75 milligrams of iron per 1 kg of body weight. Iron functions in the fetus and children. Participation in DNA synthesis, ensuring immune responses, maintenance of thyroid function glands, synthesis of basic structures connective tissue. Iron effects on immune system. If baby has iron deficiency, this deficiency can lead to lymphocytes proliferation. Lymphocytes proliferation leads to synthesis of interleukins 2 and to immune response. Basic iron containing substrates in organism and their functions. Hemoglobin participates in oxygen transport. Myoglobin in transport and deposit oxygen in the muscles. Catalase participates in decomposition of hydrogen peroxide. Cytochrome in tissue respiration. Peroxidase in oxidation with H2O2. Transferrin participates in iron transport. Ferritin in tissue storage of iron. Hemosiderin also tissue storage of iron. Xanthine oxidase participates in uric acid formation and dehydrogenases in catalysis of redox processes. Iron absorption. Balanced daily diet contains 10-20 milligrams of iron, but at the same time absorbed only 1-2 milligrams. There are 2 types of iron in food, hem and non-hem. Iron is more easily absorbed in the form of hem. This form contains meat products. The absorption of iron from fruit is no more than 2-3%. Meat, fish increase the absorption of iron from vegetables and fruits while they are used together. On this table, you can see iron content in animal products. So, content of iron content in ham products. The most high level of iron in the liver, 6.9. Also in beef tongue, in rabbit meat, and in horse meat. On the next table, you can see iron content in plant foods. The most high level in sea kale, in rose sheep, in buckwheat from cereals, in lentils grain, in soy grain. Etiology of iron deficiency anemia. Exogenous and endogenous factors. Exogenous factors: elementary, artificial, and mixed feeding, late introduction of complementary food, unbalanced nutrition can lead to iron deficiency anemia. Among the endogenous factors, malabsorption syndrome, blood loss from rectal fissures, from hemangiomas, from duodenal ulcers, from juvenile bleeding, helminthiasis, and in babies with severe diseases and foci of chronic infections because iron uptake by macrophages. Postnatal causes of anemia: insufficient intake of iron from food, increased iron requirements in children with accelerated growth, diseases of the gastrointestinal tract, deficiency of iron stores at birth, anatomical congenital anomalies of the intestine, consumption of foods that impair iron absorption. Degrees of anemia by severity. We have 3 degrees of anemia: mild, moderate, and severe. For example, in mild anemia, we have a level of hemoglobin 90/110. In moderate, 90/70. And in severe degrees of anemia, level of hemoglobin less than 70. Pathogenesis of iron deficiency anemia. Anemic hypoxia. Synthesis of hemoglobin is impaired due to lack ferrum and low erythrocyte production. Then oxygen transport to organs and tissues is disturbed and hypoxia develops. Inhibition of the activity of tissue respiration enzymes. Violation of the synthesis of ferroenzymes, cytochrome, oxidase, peroxidase, changes tissue metabolism. Dystrophic changes occur in the skin and its appendages, mucous membranes, with the development of siderapenic syndrome. Iron deficiency anemia is a serious illness with a number of symptoms in different organs: skin and mucosa, nerve system, digestive tract, heart, and circulatory systems. Siderapenic syndrome. Dry skin, hair change, nail changes, halitosis or angular stomatitis, siderapenic glossitis, siderapenic dysphagia, fatigue, muscle weakness, perversion of taste, pica chlorotica and smell, delayed physical and psychomotor development, headache, and hepatosplenomegaly. Hypoxia syndrome, pale skin, dyspnea, dizziness and fainting, pain in the heart, paresthesia in limbs, lymphedema. Physical symptoms: tachycardia, arterial hypertension, weakened diffuse tone at the top, systolic murmur at the apex, non-stop noise on the jugular veins. On this picture, you can see some signs of anemia, flat nails and hair loss, paler skin, glossitis, atrophy tongue receptors, angular stomatitis, changes of in the angles of the mouth, burning tongue. By the heart, tachycardia, systolic murmurs, enlargement of the heart, and dyspnoea. Gastrointestinal tract, lack of appetite, dysphagia, constipation, diarrhea, esophagitis, and heartburn. By the nerve system, chronic fatigue, distraction, headache, tinnitus, weakness, and tremble. Laboratory criteria: the hyperchromic microcytic nature of anemia with a heterogeneous population of erythrocytes. The most sensitive indicator is anisocytosis, finding of sideropenia. Macrocytosis, recorded by a decrease in the average erythrocyte volume, typical indicator of iron deficiency. For example, of this picture, you can see blood picture of normochromic and hyperchromic erythrocytes. Quantity of reticulocytes, content of leukocytes, content of platelets stay more often within the normal range. Blood chemistry, a low level of iron in blood serum, serum iron binding capacity increased, latent iron binding capacity of serum increased, transferrin saturation with iron coefficient is lowered, serum level ferritin 2 lowered. Therapeutic doses of oral salt iron medication. In the treatment of iron deficiency in children, we use such doses. Up to 3 years, 3 milligram per kg per day of elemental iron. From 3 to 7 years, 50-80 milligram per day. Older than 7 years, up to 100 milligram per day of elemental iron. Therapeutic doses of oral polymaltose forms of iron preparations, medications, up to 3 years, 5 milligram per kg per day of elemental iron. Duration of treatment: full therapeutic dose of the drug must be taken within 6 weeks. Duration: the daily dose of elemental iron should correspond to half of therapeutic dose in within 2-3 months. Cannot use iron preparation during infections because bacteria also need iron. When prescribing a diet, focus not on the total amount ferrum in products, but on its form. Hem iron better absorbed than non-hem. In vegetable products, origin, cereals, fruits, ferrum is in the non-hem form. On this picture, you can see products with high level of iron and medication of iron. The most important correction factor iron deficiency is balanced nutrition and breastfeeding. Breast milk not only contains iron in a highly bioavailable form, but also increases the absorption of iron from other products consumed simultaneously with it. Factors affecting the absorption of non-heme iron in the intestine: vitamin C, meat, proteins, poultry meat, fish, and lactic acid. Iron absorption is inhibited by tannins contained in tea, carbonates, oxalates, phosphates, antacids, and tetracyclines. Risk groups for development of iron deficiency anemia: premature babies, large children with high rates of weight gain and growth, children with constitutional anomalies suffering from atopic diseases, those who are artificially fed with non-adapted mixtures, infant formulas, with chronic diseases, with malabsorption syndrome.